much. I am delighted to be here, and more than that, thrilled to have been part of the Syntax trial, which was a landmark trial of a sort that we may never really see again. This trial was done in the era of the first generation of drug-eluting stents, and it's important to think back to what we all felt at the time. We had the results of some of the earliest drug-eluting stent trials, the pilot trials that had 0 restenosis and 0 events, and we didn't really know about stent thrombosis quite yet. So we really felt that drug-eluting stents had, even first-generation drug-eluting stents, had the potential to do anything. And that led us to this trial to all comers to compare PCI and standard bypass surgery in a randomized trial. And the only exclusions, effectively, were a recent MI or that either the surgeon or the interventionalist didn't feel that the patient would be suitable for randomization to either strategy. So if they weren't suitable for randomization, they could go into a registry, but the randomized trial remains the largest randomized trial comparing these two strategies for therapy. There has never been and may never again yet be a trial of patients with such complex coronary disease. You see the mean Syntax score was 28 or 29. The mean number of lesions, 4.5. 2/3 of the patients had 3-vessel disease and 1/3 had left main disease. I'm going to go right into the results, but a couple of other descriptive elements about the way the patients were treated are worthwhile. The mean stented length was about 80 millimeters. 1/3 of the patients had 100 millimeters or more of stented length. So again, you really have to imagine this is not 2-vessel disease, this is not FAME, this is a unique trial in terms of the complexity and severity of disease. So the 3-vessel disease cohort, you can see about 1,000 patients randomized, and the initial primary endpoint 1-year results showed no statistical difference in death, stroke, or MI, and as you see here, a significant difference in repeat revascularization favoring bypass surgery. When you look at the patients in the 3-vessel disease cohort, stratified by complexity of coronary artery disease, defined by Syntax,